Sure. Hello, we are with Dr. Bhuvan Machani from Dubai. He's a shoulder surgeon, and would be great to know how is your life and how you got to be a shoulder surgeon. Hi, Bhuvan.
Hi, Daniel. Hi. Thank you for this opportunity.
Good.
Um,
Yes.
So, is that a question? I'm going to answer your question. Yes. I mean, if you're asking me why shoulder surgeon, I think it goes back to probably 96 or 97 when I was in UK. I was in UK from 96 to 2017 until I came here. It was in 96 or 97 when I first started my training there. Shoulder surgery was a scary part of the joint. Everybody was scared about the shoulder joint. Knee joint, hip joint was easy. But the shoulder joint was something like all of us at that period were scared of. We didn't know how to examine. We didn't know what to diagnose. And that's what excited me. This is a very unknown joint. A lot of movements, a lot of mechanisms, a lot of action. We use it for pretty much every day-to-day of the life, sports and everything. So I thought there is more to learn in that one. That's when I started thinking, shoulder surgery is something I'm more interested in. And from then on, literally from 1996, I put my mind, if I do something in a higher specialty, it has to be shoulder. And that's where I concentrated on that. And fortunately, I had an excellent trainers who supported me, and that got excited me more and more and made me get deeper and deeper in learning shoulder surgery. Good. So that's what was the beginning of my interest in shoulder.
Is there someone that you consider your teacher, your mentor in shoulder surgery?
I was fortunate to get in touch with. Unfortunately, he passed away 2 months ago. I don't know if you know him or not. Simon Frostick, Professor Simon Frostick. Mm-hmm. So he was from Liverpool. So I first met him in 1999. And if everyone or if anybody knows him closely, I mean, he can be very eccentric. I mean, his personal bit. But when it comes to training to somebody, he had such positive approach to teach them. And then he taught them bravery, and he made them understand shoulder is just another joint. Shoulder scopy is just another scopy, like a knee joint. So he actually gave the freedom of, making us do very early. Now, I was just in the beginning of my residency that, go on, put the scope in the joint. So see what it looks like, see what he can do about that. He didn't have any hesitation to just stand behind and make us put the scopes. And even in the beginning, I'm talking about 99, we were allowed to do acromoplasties, Bankart's repair at that time. So he gave that confidence to do well in shoulder surgery. And then at the time, it was still beginning in most of the parts of the world, and it was not known. And we started doing that as early as 1999. That's when I first put my scope in the shoulder joint. And I was only about 32 or 33 at that period. So yes, he really, has an inspiration to the trainees. There are a lot of differences about how they feel about it, but once he likes the trainee, then he taught them well.
And where did you study medicine?
General, I did my medicine from back home, India. I'm from India, southern part of India. I graduated in 94 as MBBS. And then I went, soon after that, I went to UK. And then I had to do this qualifying exam. And then started my whole training in UK. I did my basic training in Yorkshire. And then high surgical training in Liverpool. And from then on, I went to do a few fellowships at Writing. And then in Canada, Winnipeg. I spent a few weeks with Houston and then London before I started becoming a consultant.
So you moved from India to the UK, from UK, from Dubai. How was all that process to get adapted to moving with your family, I imagine?
Then my family is going to join me next month because my kids are going to join university, my son. So she's going to join me next month. So I've been alone for 3.5 years. So it has been difficult from the family front because being alone in Dubai can be pretty, isolating. But equally, Dubai gives, as you know, a lot of opportunities to get engaged in a lot of other activities, especially sports and all those things. And the reason why I left UK was another story. I think it was a failing NHS and family. My mother lives in India, so she is now coming and staying with me. So I do look after her. And so there were the family reasons why I moved to. But once I came here, the transition was difficult for the first 6 months. It was extremely difficult because it is a new way of adapting. And there's not a dedicated surgeon to say that there's only a shoulder surgeon, there's only a hand surgeon, there's only a foot and ankle surgeon. No, everybody is doing everything. And I was not sure whether I will survive as a shoulder surgeon or do I need to do a bit of everything. So that was very scary part for me for the first few months. But fortunately, as I say, if you're trained well, it didn't take long enough. In about 6 to 9 months' time, people actually got to know me as, okay, this is the only, one among the very few surgeons in Dubai or UAE who does only shoulder surgery or upper limb surgery. So it actually benefited me, made an advantage, and that, yes, I'm doing an isolated practice. So I actually got more and more patients. So the transition was tough, but thankfully, I'm doing okay. So.
And what about every day? Because you moved from the rainy England to a very sunny place. How was that in your activities of daily living?
And it's an excellent question, Daniel. If you look at that, if I ask anybody, would you like to live in a country where you have possible 3 months of good weather and 9 months of shitty weather in UK, or in UAE, you have 8 months of guaranteed good weather and 3 months of summer. And I think it's no brainer that UAE offers more. Yes, June, July, August is bad, but even those summer period, because Dubai does not sleep early, the life is on. It goes on till 2-3 o'clock, and then it starts at 5 o'clock. So you can do whatever you want very early in the morning or late in the evening. So like cycling, gym, any sport, you name it. You can golf in the middle of the night, you cycle in the middle of the night. So you have a lot of activities which will not bore you at all. So I think the quality of life with regards to that extent, I think UAE offers definitely more. And that's why you see nearly 500,000 of Dubai or UK population are living in Dubai. Yeah.
And going back to surgery, do you have a favorite procedure? Which is the area in shoulder surgery? Do you perform elbow surgery as well, or just shoulder?
I do whole of upper extremity, but my predominant practice, I would say 70-75% is shoulder. And I enjoy thoroughly doing elbow surgery, elbowscopy, ortholysis, elbow trauma. I enjoyed performing elbow trauma surgeries. And elbow replacements before it is not that popular now, either here or anywhere. But before I came here, I did quite a lot of elbow replacements. But if you talk, I do hand surgeries, wrist fusions, ligament surgeries, and all that. But predominantly, my area of expertise would be shoulder surgery. And if you're asking me what is the most enjoyable surgery, I would have to say a stabilization, but I do slightly different.
Yeah,
I do slightly different. It's just that I've not been able to teach anybody or publish anywhere. The inferior anchor, I go as far as 5:30 position, but I do a mattress suture. I take one stitch at 6 o'clock and one stitch at 5 o'clock, and that would be my first knotted anchor there. That gives me a 3-point fixation and brings everything back together. And it's something I learned myself. And the remaining, you go up doing a knotless anchor. So I enjoy doing that. I just find whenever I teach the juniors, I'll say, look, how do you hold in such a pass? And look at this, how I passed. And I get pleasure in teaching them. And then, that will be my likable surgery.
Good, good. And we had you, we had the pleasure to have you and your daughter here in Buenos Aires for the international meeting. Is there any memory that you have from your trip? Was your first trip to South America?
It was my first trip to America, and I will never ever forget that. I know it probably was the best ever Congress I've attended. I mean, I've been attending from '99, so that was the most memorable. Not just because of the Congress itself, because I spent good 12 days with my daughter. It was daddy-daughter trip, and for the first time in the Congress, thanks to you, because I became more known to the people, not because of myself. Because of my daughter, so she was entertaining the crowd with her dances and talks, and
we even had Bollywood dancing. That was great. It was very, very nice, very nice.
And that was the most memorable Congress for me. Yes.
Good. And did you have the chance to travel around together, or just did you stay in Buenos Aires?
No. I mean, we actually came about 8 days prior to the beginning of the Congress. So we went to the Iguazu, both these sites. We spent 3 days there. And then after that, we went down for our glaciers, fantastic glaciers. We spent 3 days there. Cool. So then we came back to Argentina, and then we went to Buenos Aires, and then we went around there as well. So it was good, 13 days of tour, quite memorable. And my daughter still thinks of, we talk about it every day, the food and the company, and then obviously the way you made us comfortable, it was amazing.
Okay, well, you know that the doors are open whenever you want. So
we'll do that, yes.
After all these problems of the pandemic, we will find an excuse to organize something.
Thank you.
Let me know, how do you see the future of shoulder surgery in Dubai? Because I was very lucky that had the chance to visit you and enjoy your hospitality in Dubai. It's a beautiful place and very nice people. And you told me that you had the idea to organize a shoulder association to get together with different surgeons.
So the future of shoulder surgery in UAE as such, not just Dubai, United Arab. When I came to Dubai, I was surprised with the amount of sports injuries. So back in UK, my practice was 30% of sports injury and 70% was degenerative. But in here, 75 to 80% is sports injury, and the remaining are trauma and degenerative. Because people here are unbelievably active in sports, unbelievable. They're all fitness freaks. The sport facilities, cycling, rugby, soccer, tennis, any other sports, skydiving. So the sport facilities are so much, and they're all into into fitness. So that way, I think the injuries or pathologies are not going to stop in UAE. So the future is already there, and it's going to continue to be so. But what's happening now is, I think there are some good shoulder surgeons also coming into UAE. And the concept of making a shoulder society is already being discussed about. We already have a Dubai shoulder course, but the way it works slightly different is it's the Emirates Orthopedic Association is a big umbrella, and in that we have to go through subcategories. So we are in the process of meeting people, and then hopefully at some point it will become a Emirate Shoulder and Elbow Society or Dubai Shoulder and Elbow Society. I think likely to be Emirates Shoulder and Elbow Society. I don't know the time frame to that, but it does take some time to meet people, make them understand the benefits, make them understand the advantages of why you want such a society, mainly as a learning platform, to share our knowledge, to teach them what to do, and mainly to teach them what not to do. I think that's what is important.
Yes, it takes time, but it's a very interesting process, and it just the first step to get together, to study, learn together, and many people will come and to have the title of association or whatever, the paperwork is just a consequence of all that. So I'm sure you will have there a very strong and active society. Well, Bhuvan, was great meeting you. I expect to meet you personally soon. And I imagine that you are going back to your hard work now that you are back and your quarantine has already been done, no?
In fact, this is the Dubai is just opened this week for routine elective surgeries. So hopefully we will start seeing some movements. The lockdown is eased off here. So we're back to 50% of working capacity. And from June 14th, we're allowed 100% of working capacity. So hopefully, we will be back soon.
Good. We will keep in touch, and thank you very much for your time.
Thank you so much, and lovely to have me. Lovely to be there today.
Thank you. Bye-bye.
Thank you. Bye-bye.